me now to talk about National Cataract Awareness Month are Doctors Roseanne Berger and Dr. Sandra Szyminski from our sponsors at UBMD. Thank you so much for joining me, you two.
Glad to be there.
Thank you for having us.
Of course. I'd love it if you could start off by telling us about the collaboration between the Ross Eye Institute and UBMD Primary Care.
Sure. So we, at the Ross Eye Institute, we have 3 locations in Buffalo. One in Buffalo, actually, one in Amherst and one in Orchard Park. And we generally accept all patients, especially internal medicine referrals for diabetic and macular degeneration glaucoma screening. So we definitely collaborate with the Department of Internal Medicine and welcome any referrals.
Beautiful.
And I just want to add that UBMD Primary Care includes internal medicine, family medicine, pediatrics, med-peds, and we send patients to ophthalmologists, particularly the Ross Eye Institute, because we are under the umbrella of the University of Buffalo.
That's right. Well, we're talking specifically about National Cataract Awareness Month, so I'd love it if you could explain to our viewers what cataracts are and why they matter.
So a cataract is essentially, when we're born, we have a lens inside our eye already. We call it a crystalline lens because it's clear. And then as we get older, the protein structure changes and it becomes cloudy. And what we do to remove cataracts, we'll talk about later, but we can remove it very easily and replace it with a plastic intraocular lens. As we age, it's a very common thing to develop cataracts. Actually, 50% of patients over the age of 80 do have cataracts. And it's the leading reversible cause of blindness in the world and in the U.S.
Okay, which is important to talk about then, yeah.
And I think it's important for people to realize that the sun contributes to the development of cataracts. There's certain medications that contribute to them. And even though it is most common over people over 80, it certainly can develop in younger ages too, which is why screening is so important.
That's right. Now, I know that there is a connection between diabetes and cataracts, so can you explain why?
Well, when you have diabetes, which is uncontrolled, it leads to increased oxidative stress inside the eye, and it causes the development of cataracts, which means that you don't have to be an old person to develop cataracts. If you have very uncontrolled diabetes and high blood sugars, you can develop a cataract even in your 20s and 30s. So it's really important for diabetes, not only for your body, your blood vessels and your kidneys and so forth, to control your blood sugar, but it also is important for your eye.
I think a key point that you stated a little bit earlier was that cataracts can lead to blindness, but it doesn't have to get to that point, right? So let's talk a little bit about the importance of annual eye exams, especially for people with diabetes.
Go ahead.
Yeah, I would just like to say that annual eye exams are so important because a reduction in vision can happen very gradually and subtly. And you might not appreciate it until someone has identified that there is a cataract or other eye problem. And so if you just say, has your vision changed? The answer may be no, but when you actually go and have an exam, you'll see there are some changes. And if there are, referral to the Ross Eye Institute or ophthalmologist becomes really important.
Well, let's talk about some signs to look out for, especially for our viewers that are watching right now.
Well, generally speaking, cataracts can cause blurry vision. So that can be a dinginess of colors. It could be difficulty seeing in dim light. I usually ask patients if they have difficulty night driving. That's a very early common symptom. Also halos around headlights, glare in the bright sunlight. Those are all very common symptoms with cataracts. It is not limited to cataracts, but certainly people with cataracts, when we're talking about symptoms, those are very common.
Can you tell us about some advancements in cataracts and retinotherapy?
So with cataracts, certainly cataract surgery since the time I was learning it 20 years ago has become quicker, a little bit safer, a little bit easier for the patient. We usually do cataracts under sedation in an operating room, but because they're much quicker than they used to be, the sedation and the risk is much less. In terms of intraocular lenses too, those have advanced quite a bit. So we do have lenses that standard lens helps you see distance well, but you need reading glasses. But there are multifocal lenses, which is like a bifocal in the eye. And now we have light adjustable lenses, which help you see near and far, but are adjustable after cataract surgery. So you can change the prescription in small increments in the office.
Well, this has been great information. Where can our viewers go to learn more, especially if they'd like to book an appointment with either of you?
So UBMD Primary Care, like Ross Eye Institute, has multiple locations. We're located downtown in the Conventus building. We're also located on Hopkins, and then we have another office in Sheridan Drive and at ECMC. So we have lots of opportunities for people to come in.
Alrighty, doctors, thank you so much for coming in and bringing awareness to this important topic.
Thank you very much.
Thank you. Thanks for having us.
You can learn more about all of their locations and how our sponsors at UBMD Primary Care and the Ross Eye Institute can help you take better care of your vision by visiting rosseye.com or ubmdprimarycare.com.